I was first diagnosed as a diabetic back in 2000. I was 222 pounds. I used to feel sickly all the time, like a lot of ailments, back pains, this. We meet as a group, as well as we do have individual one-on-one consultations with the doctor.
This is just providing guidance upon the type of healthy foods that will help people better manage and hopefully reverse their diabetes.
But the group setting gives you encouragement, you get feedback. You know, if you see somebody out on the street, hey, how you doing? How you making out?
The aim of the one-year program is to provide that support to try and make it as easy as possible for people to make those changes.
I had lost 22 pounds. I was going down. Now I'm feeling a lot more comfortable. I feel like you actually do feel lighter. You know, you feel more energized.
If you're a diabetic and you say, you know, I really would like to get a better control on this, such patients who have that type of motivation, this is an ideal program for them.